process of EMDR and how
Okay.
it works. So EMDR is a memory-focused psychotherapy. It was developed by a psychologist, Francine Shapiro, in the late 1980s. The first research study was published in 1989. And it's based on the idea that psychological problems are due to the failure to adequately process traumatic experiences. And these unprocessed traumatic memories remain in our nervous system, unprocessed, right? And they affect how we perceive, they affect the decisions that we make, they affect reactions that we have, symptoms that we experience. And we don't want to keep cutting back the weeds and having them grow back again, right? Managing those symptoms, struggling with those decisions, and then a day later, a week later, getting triggered again and getting disoriented, having trouble all over again. We want to get those weeds out by the roots. So we search for touchstone memories. We search for the memories that continue to bear influence in some way. So a new client comes into therapy and they say, I'm struggling with anxiety and panic. I ask them to take me to the most recent experience of that anxiety or panic, what triggered it. And then I have them float back, tracking their body, tracking their emotions back to the earliest time or the first time they remember experiencing anything like that. Once we've identified a target memory, an earliest time or a worst time, we activate the memory through a series of questions. What picture represents the worst part? What's the negative belief that comes with it? The feelings, the sensations. And we introduce sets of back and forth eye movements. So I might ask the client to follow my fingers back and forth, or I might have them follow a digital light or a ball that moves laterally back and forth in person or online virtually. And we've also found that other forms of what we call bilateral stimulation work in this process. So alternating tones, right? Wearing headphones that go beep, beep, beep. Tapping, I might tap on the client's hands as they sit in their lap. Or we might have them do the butterfly hug, which is what Prince Harry demonstrated on international television, where we have the clients, I don't know if you can see, cross their arms over their chest and either tap here or tap on their chest.
So tap on their shoulders or tap on their chest.
On their chest.
And so when you say bilateral, can you explain that in simpler terms? Because bilateral means, are you impacting both sides of the brain, right and left?
Bilateral simply means that we're asking the client to orient right, left, right, back and forth, right? Using both sides of the brain, exactly. And we do sets of this bilateral stimulation, usually last 30 to 60 seconds, something like that. And then we check in. So we say, think about the trauma, follow my fingers. What do you get now? What's coming up? With every set of bilateral stimulation, we ask the client to notice what changes, what comes up, and to report thoughts, feelings, sensations, impulses, insights, more details. And we ask the client to just be a passenger on the train, just noticing the scenery as it goes by, right? We're not asking them to relive it. We're asking them to observe it or witness it.
So that means they're not in it, and they're not in it as you're
correct.
taking them through the process. So then it's not as, because it can be traumatic
exactly
to go and do that kind of therapy. So when you're a passenger on the train, it's almost like you're one step removed. It's like you're seeing it, but it's not like it's happening to me.
And that's one of the most critical aspects of this therapy, that we use what we call dual attention, that at all times the client is grounded and oriented to the present, connected to their therapist and their environment, and they're really observing, they're witnessing, they're not reliving. And, we always say to folks, there's no supposed tos, there's no shoulds, let whatever comes up, come up. And people process fear, they process grief, they process anger. No two people process in the same way. For some people, there's a lot of words, a description. Other people, it's a very emotional experience. Other people, there's a lot of things happening in the body, and we just track and follow what's coming up in the body. But there's opportunities as they're processing to I might invite a client to say or imagine doing what they were never able to do at the time. So to speak to their perpetrator, or to imagine running away, or to imagine fighting back with superhuman strength. So they have a chance to, in a sense, put a new ending on the story and encode that, right? Incorporate that in. We're transforming the memory. So they're going to restore that memory with a new take on it, a new ending.
And this seems to be very important. So you're